The patient had seroma post-operatively that was treated with aspiration, compression, and antibiotics. What was that, right? All right, that is nothing to freak out about, guys. My name is Samantha, and I also go by the name of Rio MLD. I am a post-op provider in Chicago, Illinois, and I am currently working underneath Dr. Azizi at Ram Plastic Surgery, and before then, I was doing post-op for many years. Anyway, let's get to the chase right now, and I'll let you know what a seroma is, when to freak out about it, when not to freak out about it. All right, I am going to be reading from... No, I'm not. Takes too long. I'll screenshot it. All right, so what does all that mean? That means when your body goes through trauma with force, like I said, or like liposuction, there is the area of the skin, there's the area of the muscle. In that area in between, that area can fill up with fluid. That would be the seroma area. So if that happens to you, this is when you can see a seroma, and do not freak out. It looks like this. That is a seroma, and seromas are very, very common after surgery, especially liposuction, and especially if you are an obese client, or especially if you have more lax skin, for that fluid to build up between the skin and the muscle. That fluid in there, if it is not absorbed, and it's just like a little puddle, if you will, kind of like a waterbed, that's a seroma, and it's nothing to freak out about. So you have to ask your provider what is the steps to do, right? And your provider, if it is small enough, is most likely going to tell you, don't worry about it. It's small, your body will reabsorb it. Just keep it compressed, keep doing what you're doing, right? Now, if it's bigger, they may have you come in and get it aspirated. So some girls will actually go ahead and get it taped. All right, not my first recommendation to do it, because if you do not want to come in and get it aspirated, you're most likely also not going to be getting it taped every few days either. So I would highly recommend talk to your provider. If they want you to come and get it aspirated, go and get the damn thing aspirated. And it's not that big of a deal, guys. But there are some times when seromas do become a big deal. And I'm going to be showing you some examples of when it's not a big deal and when it is a big deal. And the main reason it becomes a big deal is because it gets neglected or it gets aggravated, and that area becomes more inflamed. So I'm going to insert a little video, guys, here. A video that I did like a long time ago, a couple years ago actually, of a client of mine that I had. She was mobile and I was going out to see her. And she had been neglected by her surgery center. And not only that, she was also seeing providers that were putting wood therapy on her way too early. And this was a damn tummy tuck, guys, okay? And they're putting freaking wood therapy on her super early, which is crazy to me. So I was actually able to see her only once in a while, and we did have progress with her swelling. I'll show you right here. But that seroma, I could not do that. I'm a massage therapist. I am not only not able to aspirate because I can't do that. I haven't been trained in that either. So that's not my job. The insurance is gonna help her pay for this, which is amazing. So a lot of hardness underneath, they're gonna actually scrape out. So I'm excited for her final finale, revision, complication. Let's just get rid of it all so she can have the summer that she wants, okay? And that's it. Turn this side one more time. Yeah. All right, it's almost a week post-op right here. She had, one of her implants was stuck up here, and they removed she still looks good. Tummy tuck, let's check this out. So she's swollen right now. Go ahead and turn for me. All right, so she's swollen. But that big lump of seroma, that seroma baby that she had, is gone. And she's just swollen right now. Okay, so update on my client. She did get a seroma. Again, so when she went back to go see her doctor decided to open up her tummy tuck incision. And this is after she had already had the drains taken out. So she opened up the incision and she stuck an open drain in her. She doesn't live like right around the block from her doctor, so it's not like she could get in there and get aspirated. So that's what her doctor recommended. And that's what she did. With that being said, I didn't work on it. I told her I wanted her to fix the seroma issue, get the drain out, get the incision closed. That's what I want to do, because I guess technically I could have worked on her. We could have put like a gauze over it, and I could have worked over her doing manual lymphatic drainage, but I wanted her to resolve that issue first before I touched her. Okay guys, I'm with my client here. She's over 3 months, so she's like no faja now. Her doctor, that's what her doctor recommended. So I'm gonna show you guys her incision. And it's a really good incision. And she's a little bit swollen underneath there, so I'm gonna try and work under that. She is gonna get massaged today. She's definitely getting manual lymphatic drainage to start off with. Overall, she's looking really good. And turn to the side. Either side, yeah. Man, no seroma. Seroma is gone, nowhere to be found, hopefully ever again. All right, main thing in this video that I want you guys to get out of is seromas are mostly not a complicated issue. If you have one, your provider will aspirate it. If you find one and you're curious about, is this thing gonna go away, let your provider know, let your surgeon know, and they'll let you know what to do from there. Like I said, it's usually get that aspirated, okay? And after that, you put your compression on it. Little by little, it'll start to go away. Now, if it doesn't go away and something continues to get bigger or something just is not looking right, and your surgeon or the center that you went to is not giving you the answers that you want, it never hurts to go get a second opinion, okay? So as you can see in this video, even though this patient went to a different place, she did get a seroma. The difference is the first place that she went to did not address the issue right away. And the second place, you know, it became an issue, but it was addressed. So sometimes when we have a complication, all they need to do is get addressed. Their healing took a little bit longer, but it was fixed. So that's all I got, guys, for the seroma video. Like and subscribe.